Welcome to the deep dive. Today we're tackling something pretty specific but really important for our dogs and cats.
hmm
Skin adenocarcinomas. You know, the ones that come from sweat or oil glands.
Right.
We know you want solid info without getting bogged down, so that's the plan. Cut through the noise, get clear on these conditions.
Exactly. We'll be zeroing in on two main players, Apocrine sweat gland adenocarcinomas and sebaceous gland ones.
Okay.
And yeah, we've pulled together the research to give you a hopefully clear picture.
So the mission is basically understand what they are, how vets spot them, treatments, and the outlook.
That's it, the fundamentals.
All right, let's start right there. An adenocarcinoma of the skin. What does
Yeah.
that actually mean?
So basically, it's a malignant tumor cancer that starts in gland tissue.
Glands in the skin. Right.
Yeah, in this case, the apocrine glands, they make a kind of sweat, and the sebaceous glands, the oil producers.
Gotcha.
And it's really important to say both of these are thankfully pretty rare in dogs and cats.
That's good news.
It is. But that rarity, it makes big studies tough, so sharing data is super important here.
Makes sense. Rare is good, but
All right.
still, we need to know. When do these typically show up? What kind of pets?
Generally, you're looking at middle-aged to older pets.
Okay.
And interestingly, one study did hint that maybe female dogs get the apocrine type a bit more often.
Huh. Any idea why?
Not really, it's just an observation for now. Could be hormones, could be something else. It's one of those things researchers might dig into more.
So, if I'm a pet owner, what am I actually looking for? What are the signs?
Well, the first thing might just be, a lump.
Yeah.
Often firm, raised, on, or just under the skin.
Okay, a lump.
But sometimes these lumps can ulcerate, the skin breaks open, so you might see
Yeah.
bleeding or just redness and inflammation around it.
Right, but lots of skin things can cause lumps or sores, can't they?
Absolutely, that's a key point.
How do these two types, the apocrine and sebaceous, look different? Any clues there?
Yeah, there can be differences. Apocrine ones are often kind of sneaky, poorly defined borders, hard to tell where they end.
Ah,
And they tend to be really invasive locally, like they grow down deep under the skin. You see them a lot on the main body, the trunk in dogs.
okay. Invasive and the sebaceous type.
Sebaceous ones, well, they're often ulcerated and inflamed too, but maybe the bigger thing there is a moderate risk of spreading to nearby lymph nodes. Usually not as aggressively invasive right under the skin as the apocrine type, though.
Lymph nodes, right. And you mentioned tracking earlier. What's that about?
Yeah, tracking, think of it like the cancer cells using the natural pathways in the skin.
Like little highways?
Kinda, yeah. Or using the lymphatic system, the body's drainage network, to spread out locally.
Okay.
And we can sometimes see signs of this dermal and lymphatic tracking pretty early on with both types. It's a really important clue for the vet.
Knowing causes helps sometimes. Do we know what causes these?
Yeah.
Any risk factors?
That's the tough part. Right now, we don't really know. Yeah, the specific causes, the risk factors for either type, still unknown. Because they're rare, it's hard to do those big studies to find links.
So no known genetic link or anything like that yet?
People are looking into genetics, environment, maybe even viruses, but nothing definite yet. It's a gap in our knowledge, for sure.
Okay, so someone finds a lump, takes their pet in.
Hmm.
How does the vet figure out if it is one of these? What's the process?
Right, so first the vet thinks about differentials. What else could this be?
Like the more common stuff.
Exactly. Other skin tumors, maybe some weird inflammatory things like histiocytic disease, immune problems, even just a bad infection.
Okay.
They'll usually run standard blood tests, urine tests. Often those come back normal, which is useful because it suggests it's probably not a body-wide illness causing the skin issue.
So the blood work might be fine. What's next then for the lump itself?
Imaging is key. Chest x-rays, thoracic radiographs are really recommended right away.
To check for spread.
Yep. To see if it's gone to the lungs or anywhere else distant. But the absolute gold standard diagnosis comes from a biopsy.
Taking a piece of the lump.
Exactly. Taking a sample, sending it to a lab for histopathology, looking at the cells under a microscope. That's how you know for sure what it is.
Okay.
And alongside that, the vet will want to check the nearby lymph nodes, the draining ones, maybe with a needle aspirate to get some cells, or even taking a whole node out surgically.
So you get the sample, it goes to the pathologist.
Yeah.
What are they looking for specifically for these adenocarcinomas?
Good question. For the apocrine type, they're looking for invasion. Cells pushing into the surrounding tissue, the stroma, and often, crucially, into blood vessels.
Ah, blood vessels. That sounds important.
It is, very. The borders are usually fuzzy, ill-defined, and they look at the mitotic index, basically, how fast the cells are dividing. A high index means faster growth.
And for sebaceous.
With sebaceous adenocarcinomas, a common finding is invasion into lymphatic vessels. That's a key feature they look for.
Okay, so let's say the diagnosis comes back. It is one of these. What's the treatment plan look like?
The cornerstone for both types is surgery. And not just any surgery, aggressive surgical removal,
Aggressive meaning?
meaning an unblock excision. You take the whole tumor out, plus a really good margin of healthy tissue all around it, like cutting out a whole block.
To get any stray cells.
Exactly. And very importantly, that often includes removing those draining lymph nodes we talked about.
Why take the nodes out too? Seems like a lot.
Because that's often where these cancers spread first. Looking at those nodes under the microscope, histopathology, again, is absolutely vital.
For prognosis?
For prognosis, yes, figuring out the likely outcome,
Mm.
but also for deciding if more treatment is needed, like chemo or radiation. We call that adjuvant therapy.
Right.
And after the surgery, the pathologist looks at the whole piece of tissue that was removed, especially the edges, the margins.
To make sure they got it all.
Precisely, to confirm clean margins, no cancer cells left at the edge.
Okay, but what if you can't get it all? Like if it's in a tricky spot, or if you're worried some cells might be left?
Good point. That's where radiation therapy can come in. It can be used after surgery on the lymph node areas to sort of mop up anything left behind and reduce recurrence or spread.
Okay.
Or if you just couldn't get the whole tumor out surgically, radiation might be used on the main tumor site itself.
What about chemo?
Chemotherapy. Well, it's been used, anecdotally, for both types in both dogs and cats. But chemo protocols change, new drugs come along.
So talk to an expert.
Definitely. Consulting a veterinary oncologist is the best bet. They'll have the latest info for that specific situation.
Makes sense. And pain control, obviously.
Oh, absolutely. Managing pain is crucial. Usually NSAIDs, maybe other pain meds as needed. That's a big part of the care.
So the pet gets through treatment.
Mm-hmm.
What's the long-term picture? What's the follow-up and prognosis usually like?
Okay, so for sebaceous gland adenocarcinoma, we honestly have less solid data on how often it spreads far and wide.
Right. The rarer ones are harder to track.
Exactly. But we do know it can pop up in those regional lymph nodes pretty quickly sometimes. The upside. Anecdotally, if you hit it hard surgery, maybe chemo, maybe radiation, that multimodal approach,
Yeah.
the long-term outlook can actually be pretty good.
That's encouraging. What about the apocrine type, the more invasive one?
For Apocrine, the prognosis is generally called fair to good. But there's a big but.
Logic.
Remember the pathologist looking for blood vessel invasion? If they find that vascular invasion, that's a negative sign. It means there's a higher risk the cancer has already spread or will spread systemically, metastasize.
Ah, okay. So that finding really changes things.
It does. In those cases, aggressive surgery followed by chemo is really the recommendation to try and extend survival. There was one study in dogs. They found a median survival time of about 30 months after complete surgery.
30 months median.
Oh, okay.
So it gives you some idea.
Right. So wrapping this up then, these are rare, which is good, but definitely serious skin cancers.
And it sounds like catching them. Getting a really thorough diagnosis, including checking those nodes and looking for invasion under the microscope, is key.
Couldn't agree more.
Followed by pretty aggressive treatment, usually surgery first and foremost.
That seems to be the best path for a good outcome. Those microscopic details, vascular invasion, lymphatic invasion, they really tell us a lot about what might happen next.
Yeah. Well, hopefully this deep dive has, shed some light without being too overwhelming. Cover the basics, signs, diagnosis, treatment, outlook for both types.
Yeah, hopefully giving you a solid, digestible overview.
And thinking about what we don't know,
Yeah.
like the causes.
Hmm.
It really makes you wonder, doesn't it?
Hmm.
What's the next big breakthrough going to be? What research areas are most promising for figuring out why these happen and how we can maybe prevent them or at least catch them even earlier in our pets?
That's the million-dollar question, isn't it? Something to keep thinking about.
Definitely food for thought. Thanks for joining us for this deep dive.